So through the community mental health transformation work, we're really aiming to change the way that care is delivered to people of County Durham, to be more localised to their local community. We're kind of delivering care in partnership with other organisations, so it'll not all be delivered through Tuve, although we'll be very much involved in the kind of design and delivery and implementation of those services. So it's much more about trying to address some of the current gaps that exist between services and the handoffs that occur between different parts of the system. We're aiming for a much more joined up way of working to address people's needs in their entirety, so not just their mental health needs, but also addressing, for example, their physical healthcare needs as well. We've recently awarded the Police and Crime Commissioner's Office some money to fund 2 substance misuse peer mentor coordinator roles, and these peer mentor coordinators will support a range of people with lived experience of alcohol and drug misuse who are going to be trained to deliver low-level harm minimisation approaches and motivational techniques that they can work alongside people who are currently experiencing alcohol and drug issues, to kind of really, as I say, get alongside them. They've been there, they know what it's like, to kind of see what support they need and help them to access services. So our kind of aim in wanting these peer mentor roles is that they'd be able to follow people anywhere across the system. So whether that's in primary care where their GP can refer them in, or the new secondary mental health services, or police, or anybody can refer into the peer mentor program, and they will be able to follow you whichever part of the service you're accessing, or even if you're not accessing any services at all, they'll still be there to kind of help and support you from a lived experience perspective. So the money was given to the Police and Crime Commissioner's Office for this particular service development because there's an already established peer mentor program that's been incredibly successful. It just made sense to give that money to a service that have already got a really good track record in kind of recruiting and supporting peer volunteers. They've already got that expertise and the systems and processes set up to be able to do that, and they were really keen to be able to take this initiative forward.
Hello there, my name's Cunningham. I'm lucky enough to be the manager for the Community Peer Mentors, and we belong to the Durham and Darlington Police and Crime Commissioner's Office. And for the last 7 years we've been supporting people who through unfulfilled needs have become reliant on the emergency services. The fact is that what we found is that the people that we're supporting invariably have been let down by these services in some way, or even forgotten by society. And our aim is to help to support that person, to get them back on track so that they feel more empowered to deal with life. The idea is that with this new initiative, supporting people with alcohol and substance misuse, is that we will work and support that individual for as long as they need us, and as long as they show they've got the will and want to change. And it doesn't matter which services that they go into, there will not be an end of the support from us. And that means that helps bring that person to a better well-being in their life. But our hope and wish is that we can support as many people as possible so that they can bring themselves to re-engage with the community, to build trust and to make them feel safer, and therefore making sure that there is support there for people from wherever they come from in their lives.
My name's Louise Crook. I'm an area coordinator for the Community Peer Mentor team on behalf of the Crime Commissioner's Office. So people with mental illness and other complex emotional needs who also use alcohol or other substances have historically struggled to access services. So my role is to help those people in the community be able to access the services that they need, also providing them with peer mentors who have lived experience. Our peer mentors are people who have lived similar experiences to those that need support, which gives them a greater understanding of what these people need. They can spend a lot of time supporting these people in the community, helping with things in their day-to-day life that in turn can make a huge difference. So it's a real positive step that we're able to work alongside the NHS on this project, which in turn opens it up much wider across the community for more people to be able to access our service.
Absolutely fantastic to see how much the training has already impacted upon our coaches and the difference it's going to make to the clients that they work with. It's really, really important to listen to what people are saying. Very easy to give them the solutions, but the problem has to come from the individual to understand how we can get the best recovery, the best outcome and the best wellness for the people who we are working with going forward. So I'm absolutely delighted to be here, hearing all the wonderful things that's going on, and I can't wait for them to hit the ground running with all this renewed training and refreshed ideas.